Hi everyone, my name is Julianna, and today Daniela and I will be speaking about social anxiety. Before we begin, we would just like to do a land acknowledgement, and this is for Toronto, where the Dish with One Spoon territory and X University are located. Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. Our agenda for today will include the following: an introduction, what is social anxiety, some statistics about social anxiety, the risk factors for social anxiety, and the warning signs. Then I will hand it over to Daniela, who will speak about treatment, misconceptions about social anxiety, coping with social anxiety, how to support someone living with social anxiety, supporting a client living with social anxiety, some resources, and some important points to remember. To begin, everyone has anxieties from time to time in certain situations. But for those living with social anxiety, every day can be a struggle, especially within social situations. It is a common misconception that social anxiety is the same as shyness, but this is the furthest thing from the truth as they are very different. Shyness is short-term and does not disrupt one's life, while social anxiety is persistent and can even be debilitating. Social anxiety is a type of anxiety disorder that is characterized by the significant anxiety, self-consciousness, and embarrassment that can arise from everyday interactions. In social anxiety disorder, fear and anxiety can lead to avoidance that can disrupt your life and severely affect your relationship, daily routines, work, school, and other social or everyday activities. Social anxiety is a treatable mental health disorder, and those who have social anxiety often find relief in psychotherapy and taking anti-anxiety medications that can help them gain confidence and improve their ability to interact with others. Now moving on to some statistics. Social anxiety disorder is one of the most common anxiety disorders, affecting between 7 and 13% of the population. An estimated 12% of adults will experience social anxiety disorder at some point in their life. The prevalence of social anxiety disorder among adults is higher for females at 8% than for males at 6.1%. Of adults with social anxiety disorder in the past year, an estimated 29.9% had serious impairment, 38.8% had moderate impairment, and 31.3% had mild impairment. And in children, an estimated 9.1% of adolescents that had social anxiety disorder, an estimated 1.3% had severe impairment. The exact causes of social anxiety disorder are unknown, but there's plenty of research that supports the idea that this is caused by a combination of environmental and genetic factors. For example, a serotonin imbalance in the brain may contribute to this condition, as well as having an overreactive amygdala. The amygdala is a part of the brain that controls fear response and thoughts or feelings of anxiety. Anxiety disorders also commonly run in families, but it is not exactly known if this is due to a link in genetic factors. For example, a child may develop an anxiety disorder by learned behavior from their parent who also has the disorder. Children can also develop anxiety disorders as a result of being raised in a controlling or overprotective environment. It is also theorized that negative experience can also contribute to the development of the disorder, such as bullying, family conflict, sexual abuse, and emotional abuse. It is important to note that feelings of shyness and discomfort aren't always signs of social anxiety, particularly in children. In contrast to everyday nervousness, social anxiety disorder includes fear, anxiety, and avoidance that can severely interfere with daily routines. Symptoms of social anxiety typically begin within the early to mid-teens, but it can also begin earlier, such as in younger children, and in older individuals, such as adults. There are 3 categories in which social anxiety disorder symptoms typically affect. These include emotional and behavioral symptoms, physical symptoms, and avoiding common social situations. To begin with emotional and behavioral symptoms, these include fear of situations where you may be judged, constant worry about embarrassing or humiliating yourself, intense fear of interacting or talking with strangers, fear of physical symptoms that can cause embarrassment such as blushing, sweating, trembling, or shaky voice, avoidance of doing things or speaking to people out of fear of embarrassment, avoidance of situations where you might be the center of attention, anxiety in anticipation of a feared activity or event, intense fear or anxiety during social situations, analysis of your performance and identification of your flaws in your interactions after a social situation, expectations of the worst possible consequences from a negative experience during a social situation, and in children, anxiety about interacting with adults through crying, having temper tantrums, clinging to their parents, and refusing to speak in social situations. Next are physical symptoms. There are some physical symptoms that commonly accompany social anxiety disorder and can include the following: blushing, fast heartbeat, trembling, sweating, nausea, being out of breath, dizziness or headache, and muscle tension. And lastly, avoiding common social situations. Everyday experiences that can be difficult to navigate with social anxiety disorder include interacting with strangers, attending parties and social gatherings, going to school or work, starting conversations, making eye contact while speaking, dating, entering a full room, returning items to the store, eating in front of other people, particularly large groups, and using a public restroom. It is important that you or if someone you love is experiencing social anxiety symptoms to get them help and know that they are not alone.
Now we'll discuss treatments. Treatments that are used will rely on how social anxiety impacts you in day-to-day life. Most commonly used for the treatment of social anxiety is psychotherapy, medications, or a mix of both. Psychotherapy is used to improve symptoms and is effective in most people. Psychotherapy provides the opportunity to learn how to pick up on and alter negative thinking patterns about yourself and will teach skills useful in social situations. Cognitive behavioral therapy, or CBT, is most effective and commonly used. When the technique of exposure is used, an individual will slowly work to face anxiety-inducing situations in order to learn how to maneuver through them with the intention that anxiety will eventually decrease. There are also various types of medications that may be prescribed. The most common type and first used is selective serotonin reuptake inhibitors, or SSRIs, such as Paxil or Zoloft. Serotonin and norepinephrine reuptake inhibitors, or SNRIs, can also be used. While not as common, there are other medications prescribed, such as other antidepressants, anti-anxiety medications, or beta blockers. As with any medication, there can be side effects. Therefore, a professional may prescribe a smaller dose to start and slowly work up from there. It may take weeks or even months to see the medication working effectively. Next, we will discuss some misconceptions about social anxiety. It's important to discuss this since misconceptions often lead to stereotypes and stigmas about the mental illness, as well as a lack of understanding on what social anxiety is and how it impacts someone. As well, because they lead to stereotypes and stigmas, it's important to deconstruct what we think we know about the mental illness in order to better understand it. The first misconception we'll look at is social anxiety is just being shy. Social anxiety is more than being shy, as people living with the mental illness will experience anxiety outside of what can be expected in a particular situation and can worry excessively about a situation in advance. This can impact functioning. The next misconception is social anxiety only impacts public speaking. While public speaking can cause anxiety in people living with social anxiety, there is more to the mental illness. Social anxiety can impact other ways of socializing, such as talking to someone in a position of authority, meeting new people, or doing normal activities while under the impression that someone is watching them. Social anxiety is rare. Social anxiety is actually one of the more common mental illnesses and is increasing in diagnosis rate, which can be explained by the fast-paced and stressful environment many people now live in. The next misconception is social anxiety cannot harm a person. Social anxiety impacts individuals greatly. It can lead to a decrease in productivity, as well as increases in health issues or suicidal thinking. People can just get over it. Many people living with a mental illness do not seek help due to this misconception. However, without treatment and support, social anxiety symptoms will not go away or they will get worse. To conclude, it is important to discuss these misconceptions as they create stigmas and can lead to individuals living with social anxiety to avoid treatments. Coping with social anxiety. There are various ways that someone living with social anxiety can cope with the mental illness. The first method is social coping. Learning to say no, developing nonverbal communication skills, and practicing verbal communication are all important. This exposure, while initially anxiety-inducing, will help to eventually alleviate some of the stress involved in socializing. Talk to someone. Talking with a trusted individual can help. You can talk about how you're feeling, what it is like living with a mental illness, or engage in casual conversations to practice maneuvering through a conversation. If you want to talk about how you've been feeling but are struggling with vocalizing it, it can be helpful to write it down and share it with the individual until you're ready to have a conversation. Another technique is deep breathing. Practicing deep breathing can be beneficial, especially in anxiety-inducing situations. You can practice deep breathing, for instance, by breathing in for 4 seconds, holding for 4, exhaling for 4 seconds, and holding for another 4 before beginning the process again. Finally, some other methods include getting accommodations at work or school. When you do have to discuss or ask questions, make a list ahead of time, and have routines, including meals or getting exercise. Supporting someone living with social anxiety. There are many ways that someone can support an individual living with social anxiety, and the first step could be to educate yourself. This will help you to understand what can be expected. It's also important to avoid enabling. As many people do not get a diagnosis for a while, it's likely that they have formed routines with you that will help them avoid anxiety-inducing situations, such as you asking questions for them. While this support is well-intentioned, it can reinforce negative thinking patterns. It's important to listen to the individual's needs. However, it is also important that when they are getting help and working on exposing themselves to social situations, that they continue to practice instead of avoiding. Help them to get help. It can be difficult for people to get professional help when living with a mental illness, but it is important. By supporting them or helping them find where to get support, it can ensure them that they are not alone and can encourage them to seek or continue treatments. Acknowledge their accomplishments. Positive feedback is important when they take small steps to recovery. Even if they do not reach the goal they had at that point, it's important to let them know that you are proud and they are doing a good job. Ask them what they need. Needs differ from person to person. Therefore, it's important to understand what they need from you in terms of support. Most important, you must also take care of yourself. Establishing boundaries, reaching out to others for support, and engaging in activities that will benefit your own mental well-being are all significant. Supporting a client. There are many ways a practitioner may choose to support a client living with social anxiety. As the most common method of psychotherapy is cognitive behavioral therapy, we will discuss a few techniques that can be used to help clients combat social anxiety from the psychotherapy modality CBT. Learning to point out negative thoughts and working to challenge them is beneficial. This is called cognitive restructuring. While this alone will not fully help, it can be a step to practicing exposure. Another helpful technique is exposure therapy. This is done by creating a list of situations that are anxiety-inducing to the client and rating them in terms of how stressful they are. Clients will begin with the least stressful situation and slowly work their way up. It's important to remind them that it may be stressful initially, but it is significant to try an exposure task and keep practicing it, so eventually feelings of anxiety will decrease. While this will not happen all the time, sometimes fears do occur, and it's important to provide clients with the tools they need to manage this situation. This is called problem solving. Thinking of solutions for these situations and practicing how they would play out can be beneficial to helping a client work through social anxiety. Now we'll go over resources. The most important thing to take away from this video is that there are supports and help available. For an immediate mental health crisis, reach out to a crisis line for support. For non-immediate mental health support, a useful resource is For a Safer Space. For a Safer Space is a nonprofit that offers accessible and inclusive mental health care. Visit the website for more information if you would like to reach out for support. We'll conclude this video with some important points to remember. Everyone has anxieties from time to time in certain situations, but for those living with social anxiety, every day can be a struggle, especially in social situations. Social anxiety is a type of anxiety disorder that is characterized by the significant anxiety, self-consciousness, and embarrassment that can arise from everyday interactions. While the exact causes of social anxiety are unknown, there is some research that supports the idea that it is caused by a combination of environmental and genetic factors. There are warning signs in 3 categories in which social anxiety symptoms typically affect, including emotional and behavioral symptoms, physical symptoms, and the avoidance of common social situations. To continue with some important points to remember, there are a couple of treatments for social anxiety, such as medication and psychotherapy, and sometimes these will be used together. It's important to deconstruct misconceptions as they perpetuate stereotypes and stigmas and can lead to people avoiding treatment. There are many ways an individual can cope with social anxiety. An individual can support someone living with social anxiety in a variety of ways, but it's most important to take care of yourself. Practitioners can use techniques from CBT to help support clients with social anxiety. That concludes this presentation on social anxiety. Thank you for watching.